Hi everyone. So today I'll be discussing about removable orthodontic appliances, and I'll majorly be covering that what actually are removable orthodontic appliances, what we need to expect while we are using them, and how we're supposed to take care of them. So to start with, what are they? So, all those appliances or all those devices that can be inserted and removed from the mouth or the oral cavity by the will of the patient. That means the patient is trained and is taught by the dentist, and when he or she wills, she can or he can remove it from one's mouth easily. Okay, now they can look like all of these. So basically these are all acrylic plate sort of structures with different kind of wire bendings depending upon what kind of tooth movement has to be brought about or what kind of bone movement has to be brought about. So these are all and there are many more apart from them also. So all those appliances, all those orthodontic appliances which can be easily removed and inserted back into the oral cavity by the will of the patient are called as the removable orthodontic appliances. Now, what to expect when you are using a removable appliance. The first thing is when you put any kind of appliance in your mouth, obviously it is activated to bring about the desired movement, so it will feel tight, right? You will feel as though your entire mouth is caught up in something and you're really struggling with it. So that's the very first thing. You'll get used to it obviously in a week or so. Then you will be really conscious of yourself because obviously you will feel tight from within and there'll be some protuberances. You will feel as though there are certain protuberances which are not that obvious to the one looking from you from outside. So that is why you will also be quite hesitant in mingling with people. Then there'll be slight irritation at the point of contact of the appliance because obviously there is some foreign object that is touching your gums and they're touching your palate or tongue, so you'll have some irritation which will subside on its own. If it's severe, obviously you need to visit your dentist. Then there'll be some pinching or hurting of the soft tissues, that's obvious, but you need to tell your doctor. Even after the appliance is inserted, your doctor is going to ask you if it's hurting or pinching you somewhere, so you need to tell your doctor that time. But most of the times it happens that when you insert it once you don't feel anything, but when you go back home you feel that it's pinching here and there. Then in that case also you can contact your doctor and he'll make the arrangements that are needed, and it'll be fine after that. Then there'll be increased salivation. So basically this is the fighting mechanism of our body. It salivates whenever it salivates excessively, I should say, whenever something inappropriate enters the mouth uh, for the purpose of expelling it out of the mouth. So similarly, when this foreign object, that is your removable appliance, when it enters into the body, it is the body's response, a defensive response, I should say, protective response to increase the salivation, and that also goes away in some time. Like maximum 7 to 10 days. It usually takes 7 to 10 days for the body to get adjusted to the newly inserted foreign object, that is your removable appliance. Then obviously, because such a big thing is in your mouth now, there will always be some slurring of speech. That is the words will not be that clear initially, and or some sort of lisping will also be found, but all this will subside. Then you'll have bleeding gums. Bleeding gums will happen when the care of the teeth and of the appliance is not happening properly. So that can also be expected. And obviously, because we are inserting the removable appliance to bring about certain teeth movement and to bring about certain jaw or bone movement, then in that case, obviously, you will have pain wherever the movement is desired to happen and is happening. So in that case, the pain is absolutely normal. Okay. Now, how to care or how to go about the maintenance of the removable appliance. So the first thing that you need to do is you need to clean and rinse your teeth after each meal. Now when I say cleaning and rinsing after cleansing and rinsing after each meal, then it does not have to be necessarily with a toothpaste all of the time. You can just take a normal toothbrush without using a toothpaste, and you need to clean your mouth after eating, after each meal, or whatever snacking you've done or whatever munching you've done, because any kind of debris, food debris that is remaining in between the teeth or anywhere, if it's stuck, it will get stuck to your appliance, and then it will keep rotting and it will impart that bad smell, and you will have all sort of bleeding gums and bad breath and all that. So cleansing and rinsing of the teeth is required after each meal. Cleansing and rinsing of the appliance is required after each meal. And for cleaning the appliance, you just need to have a spare toothbrush, and you need to clean and rub the appliance with the help of cold water. You're not supposed to clean your appliance with a toothpaste, because toothpastes have got abrasives in it. They can abrade your appliance and cause wearing of the appliance where it is not required. Okay, so that can affect the treatment part also. Then you can even clean your appliance with the appliance cleaners that are available in the market, but to keep it simple, you do not require any kind of cleansers. Okay, then whenever you're not using the appliance, that means when it's not in your mouth, it has to be in that protective case which is provided with the appliance, because the appliance is the safest when it is in your mouth. Once it's outside the mouth, then anything can happen to it. It can break, it can tilt, it can warp, it can shrink, it can expand, anything can happen to it. So you need to keep it in the protective case that is provided with it. Also, while the appliance is on, you're supposed to avoid any kind of hard food or snacks, because the appliance is quite thin and it can crack, or it can break also at certain times. So you need to be aware of that. So it's always better to be preventive. Also, you need to avoid flicking the appliance in and out with the tongue, because what happens is initially, since the body is not used to it, your tongue is always playing with the components of the appliance, and you tend to keep flickering it. So you need to stop doing that. Otherwise, you'll either end up deforming a wire, or breaking the appliance, or you might even loosen the appliance. So if an appliance is loose in the mouth, it's not going to bring about any desired tooth movement. Okay, so this is all, and I tried to keep it short, and I tried to keep it summarized, so that this can help you with how you're supposed to go about with your removable orthodontic appliances. Take care. Bye.